Is it good? I'm really
All
good
right,
on the
good.
left.
You can put us on there.
All right.
All right, we're back with Real Talk 2? Okay, we're on. Okay, good. I'm with the amazing Miss Fame,
Hi.
Curtis, Dr. Paul Frank, PFRANKMD.
Yes.
A lot of travel going on recently.
I'm back.
And we have a lot of travel coming up.
100%.
You're going throughout Fashion Week. I'm
Yes.
even going to Fashion Week in Italy.
Extraordinary.
We both have to look good.
100%.
I think the major issue that we got to talk about is acne and just overall skin quality.
For sure.
Traveling, lack of sleep, stress, overwork, dietary changes, particularly when you're traveling. It's not just
Exactly.
being in the air, it's changing of your habits, your daily routine. It throws off your skin.
Sleep, non-sleep.
Exactly. By no means is this someone who you think would have an acne problem, myself included, but when our skin is thrown off, we notice it.
Yeah.
And when we feel a certain way, it reflects in the way we present to our audience,
Yeah.
and then our audience feels it. So, unfortunately, most people look at acne and skin quality as a cosmetic disease, but it affects us at every level,
100%.
internally and externally. And I have very low tolerance for skin that's not as best as it can be.
Yeah.
And we all live very demanding lives. So the answer is what can be done. And I think one of the things you were complaining to me about was that recently your habits have been off and it's been run down, correct?
Yes, 100%.
So you have to think about this at several levels. Fortunately, we always have big guns in our pocket like spironolactone, which affects hormonal acne, Accutane, but the real question is what can be done on a daily routine or periodic routine to improve it. And I think for you, a lot of it is just about keeping your pore size under control. You do get extractions,
Yeah.
right? Getting facials is regular. Obviously, doing what you can while you are traveling. Tricks about staying away from certain habits that are better than others.
For sure.
Food, I mean, we want to have a little fun.
Not too much fun.
Exactly. We've done things before, like laser type stuff before. Laser Genesis is a great laser that controls inflammation, acne. We are working on some other types of things, ultrasonic extraction. Cryofacials are really great. I think we've done some work with paparazzi facial. That
Yes, we
also
did that.
I've found calms down skin inflammation. We're going to probably do in the very near future something that will help calm down acne. What are some of the things that you see that change when you travel, and what are the things that are like your sore points? Do you actually get pimples?
I
Do
get
you feel
texture.
Texture things.
I get inflammation. My skin becomes inflamed to where I can feel it when I touch it. It might not be as obvious to somebody that's with me. They'd say, well, yeah, like you're oily. I'm an oily skin type, and I have thicker skin, and I have to be diligent. Every month there has to be a service kind of keeping my skin in check. If I'm eating right, and if I'm sleeping right, and if I'm drinking enough water, then my skin responds, and it's at its best. But because of my work, I'm constantly in the air. I'm in another country, and another type of food, and things
you're
are
applying
changing.
makeup and things.
Brings a lot of
Men and
time
women
and
who wear
makeup, yeah.
makeup. It's a battle with it because if your skin is oilier, it absorbs makeup differently.
Right.
If your skin is dry, it reflects light differently when you're wearing makeup.
Right.
So I think on an aesthetic level too, the amount of oil and the dryness and the qualities of the skin affect the way one would put on makeup.
Right.
And it affects in the camera. So these are a lot of things for people who are more on stage because they tend to wear sometimes more heavier makeup than someone who's not. These are all things that really affect it.
And when my skin's good, I don't wear as much makeup like anybody. I mean, I don't have facial hair, I've had it lasered off, so these are parts about my face where I'm not combating color correction. It's more about if I can get the integrity of my skin into a balanced place, I'm willing to try whatever it takes because I have been open to the history of like what's offered. But there's also new advanced technologies and new experiences that we can have that allow me to step into my best skin.
Well, I think as with anything aesthetic, the combination of small things make the biggest difference. There's no one cream, one laser, one anything that's going to answer everyone's questions. You have to find the balance for yourself. It always takes a little bit of diligence, but it shouldn't be confusing or hard. You just have to find your regimen. And I think for you, the lasers, the cryotherapy, your regular extractions, I think these are great. You've tried some other medicines before. We try to avoid staying on long-term medicines of any kind, antibiotics, spironolactone. Accutane is always a great option. We do something called model dosing of Accutane, which a lot of people in the entertainment industry use. It's really for that cosmetic acne where you would take a small dose 3 times a week. I call it like sprinkling over the cereal. It's very safe, it's very tolerable, it has very few side effects, and although it works really well, if you do the model dosing, it doesn't have a permanent effect.
Right.
Whereas a lot of people who take Accutane at higher doses for like a 5 or 6 month period, they may deal with some side effects, but once it's done, their skin's like perfect for like 10 years.
Incredible.
So we have to find that balance in our consideration of where Accutane can fit into any patient's kind of regimen.
Yeah.
And as you'll see with our conversation, we'll be throwing a few things together here.
And I will say that, like, let's talk about Accutane. These are things that I've never tried before, but because of talking with you and learning that the dosage can be a lot lighter, I have tried other things around it. I have used spironolactone for the last year and a half, and I had benefits from that, but I also had side effects from that.
Yeah. It's not something you want to stay on forever.
Right.
I always try and avoid oral medicines because there's a balanced cost-benefit ratio to every medicine, right? What I do like about Accutane is that it's a limited run. Yeah. It's actually the only drug I know in the history of medicine that's not an infection and you just take an antibiotic, that you can take it for a limited amount of time and then the problem generally goes away. If you have high blood pressure, high cholesterol, depression, you take it, when this medicine stops, the problem comes back.
Exactly.
So it's a unique medicine that people are very fearful of, mostly because of we live in a very right-to-life country and the fear of getting pregnant on it, and it can cause birth defects, but so do a lot of medicines, and certainly in my male patients I don't worry about it.
And I'm not afraid I'm going to get pregnant.
Yes,
so
I'm not
I
afraid
think
of
we're
the
okay.
pregnancy issue here. Okay, we may try. But
Right, we may try.
But anyway, it's a much bigger conversation. The point is, every medicine is only as good as how it's used, and that's true of lasers, injectables, everything. There's a sweet spot, and we're going to develop that relationship and figure that out. So we're going to get started, and we'll try some things. You'll tune in, and you'll see some of the fun things we do to make the skin even more perfect.
Yeah, we're ready. Let's do it.